We're graphic designers.
We're graphic
I worked in
designers.
magazines.
We work in
Will
publishing.
was the last art director of Look magazine. Maybe you remember that. I worked at
Look
Life
magazine?
Yeah, I worked at Life magazine.
Oh. Now, Life is only online now, right? Or is that Time?
Time, I think, is online now. I don't know. I don't think Life publishes. I don't know. They got bought, so they used to do like X number of specials a year to keep the name alive.
Okay.
But I don't think the Reader's Digest people bought most of Time Inc.
Oh, okay.
So
And it was Time Life.
yeah.
Yeah, so it was both.
Right.
Oh, I should put a target on my wall. And that was before you could work remotely from anywhere.
Right. And then we got married at some point, and I quit Time Inc. And we started our own business. So we did a children's magazine. Put any nail polish on them, or does that make a difference?
It's not going to make a difference right now. Actually, it won't make a difference even after. Yeah, for right now, you don't need to do anything topical, but we're going to talk in a couple minutes about treating your shoes. Because if you don't also treat your shoes, you're just going to keep getting reinfected.
Mm-hmm.
So we'll talk about that. Turns itself off after about 45 minutes so that it'll kill whatever has sprouted during the day.
Mm-hmm.
And if you do that every night during the time that we've got you on the oral antifungal, that will be a good way to make sure that you don't keep reinfecting your skin and your nails.
Mm-hmm.
So, one or the other. And I usually tell people, look, by the time you've bought 4 or 5 cans of Athlete's Foot Spray, you've paid for the UV light.
So the shoes that I already have,
Yep.
so I should just go through the shoes I have and,
I tell people, just whatever you wear that day,
okay,
just do it when you get home that night.
uh-huh.
And you don't have to...
I've lost faith in.
Yes,
Gave me a prescription to something called fluconase.
fluconazole.
Okay,
Yes.
I guess I kind of butchered that.
That's okay. For the
Um,
fungal nails?
To get rid of the fungus.
Okay, how was it dosed?
I don't remember because I never started it.
Okay.
Should I start it?
Well, you know, it's up to you. If we can we'll get this nail thinned way out today. And if we can keep it thin and comfortable, do you have to treat it? No. Whoop, did that just hit you in the face?
No. No, we're not that way.
Okay. I should have a target on my wall sometimes, I think.
Will this stuff go? How do I get rid of it? I hate it.
Well, then that would be a reason to treat it. So with these, especially with this nail, because it's all the way back here now, and so the nail's basically being produced with the fungus in it. So nothing topical is going to make a difference. So the fluconazole is also a medication that I use, but we do it along with some blood work. Now, did I see you're on a statin drug for cholesterol?
I just finally agreed to take that.
Okay, so that's the one big thing. If someone is on a statin drug, those are metabolized in your liver, as is the fungal medication. So the double whammy can be kind of tough. But what we do is, starting out for the first several months, we just draw a liver function before you start, and then we draw it every month while you're on the medication. And the medication is a once-a-week pill that I do it that way until the whole nail grows out. So I think there's a good chance that we can make a difference, but we have to follow your liver functions closely, especially because you're on a statin drug. That's a good chunk right there. Now, do I see complications on a regular basis? No. People who are on statin drugs, if we notice that there's an elevation in their liver enzymes, we stop both meds for a couple weeks and then check again, and I've never had a single patient where it didn't go back to normal. And then we just stop the fungal medication. And get you back on your statin drug for cholesterol.
I kind of let myself go for a long time.
Okay.
I was busy taking care of my wife, and well, I took care of her at home for a little more than 8 years, and then I had her in a place because she couldn't walk safely, and I was there between 6.5 and 12 hours every day.
Wasn't she lucky to have you?
Well, when people have said that to me, and I always say that, no, you got that backwards.
Yeah.
And I really believe that.
Yeah.
So she was truly incredible.
I take it she's passed?
Yeah, 1.5 years ago, I had my first heart doctor. I saw him the day after I buried her.
This is what we in the profession refer to as gunk.
Well, you got way less blood than I get.
Yeah, well, up here, the skin is so close under the nail
Yep.
that when I took off a little piece of nail right there, it took off a little skin with it, but it'll be fine. We'll put a little antibiotic Band-Aid on it.
No, I get lots of blood. That's when I decided I gotta find somebody to help.
Okay, good. Well, yeah, these 4.
Uh-huh.
So what we're gonna do is we're just gonna trim this back. Now, you're right. You see how this is growing over in that direction?
Yes.
And anytime you injure the growth center of the nail, which is back under the cuticle there,
Mm-hmm.
it can cause the nail to grow in an unusual fashion. It can be thick, it can be discolored, it can just grow in the wrong direction. So this actually looks like instead of growing out this way, it's just growing that way. So we'll just trim it that way and just keep it short and thinned out. This is just all schmutz.
Mm-hmm.
That's a technical term.
Of course.
To me, it looks like it's growing from here over to here
Right.
and has grown back into the skin. I find it hard to fathom that you say this one doesn't even hurt. Okay, so that's a big chunk there.
Oh, yes.
And it just had the debris underneath. But yeah, can you see right where it was pushing into the skin here?
Yes.
That was gonna break the skin pretty soon.
Mm.
So it is good that you came in now.